Five, four, three. Welcome back to the Daily Drum on WHUR 96.3, 96.3 HD2, Sirius XM channel 141 and 98.3 FM. I'm Bramante Bryant in for Harold Fisher. This is the Insight segment. Medicaid is crucial for many, and for many who count on the federal and state funded health insurance. They need to be ready now to take some steps to ensure that they keep their coverage. Tonight, we're talking about what you need to know about deadlines and paperwork so you can count on Medicare to be there for you. Our guest tonight, Daisha R. Watson, Management Analyst for DC's Department of Healthcare Finance, and David Kennedy, Associate Healthcare Ombudsman with the Office of the Healthcare Ombudsman and Bill of Rights. David and Daisha, thank you so much for being with us.
Thank you
for having us.
Daisha, let me start with you. What is the call to action here? Folks, like I said, thousands, and we're talking DC now, right, have Medicare. What is it that they need to know, what they need to be doing, what's different right now for them?
So as of right now, we just ended the public health emergency. So during COVID, a lot of our DC residents who had Medicaid were extended for a long period of time, which means they did not have to renew their benefits manually. So we're going back to that. So prior to COVID, all of our DC residents had to submit a annual renewal to renew their benefits. Now they will receive their renewal benefits packet in the mail for them to recertify their benefits. They have to submit that so that their Medicaid eligibility can be redetermined for continuation. So that's a major change that we want people to know. They have to manually submit their renewals for their benefits now. So we are encouraging all of our DC residents to go on districtdirect.dc.gov. That's the fastest way for them to renew their benefits. They will receive renewals in the mail. So we're encouraging everyone to ensure that their addresses are up to date, their emails are up to date, so that they're actually receiving the information that we are sending out. So most beneficiaries now should be on their second renewal. Like I said, April of 2023 is when the public health emergency was considered over, if you will. So that's the time frame now in which we have to go back to those manual updates. So we're encouraging everyone to ensure that all of their contact information, I can't reiterate that enough, making sure that their information is up to date so that they are receiving the information that we're sending out to renew their benefits.
David, when you hear most folks, when they hear manual now, I mean, back in the day, manual was just the template. You had to do everything manually. Now it's,
Right.
It just comes to you and you hit a button and it's there. I could see where that would be daunting for some folks. And so in terms of really trying to get that information of how you manually, and I really mean that in terms of really, you have to, I'm assuming you really almost have to walk folks through to like, these are the steps that you need to take. How do you do that, David?
Thank you. And you're absolutely right. It definitely can be intimidating when somebody does need to go online and complete their recertification, especially for the generation who to this day still may not even own a computer. And with that being said, while district directed going online is the preferred way, we are still accepting applications to be sent by mail. If people want to mail them in, you can hand walk your application or recertification into the service center. And there's 4 locations here in the district where applications can be dropped off at. One of the main ones being 645 H Street Northeast. And then you have a location at 2100 MLK Avenue there in Anacostia and Southeast. And then the location on Taylor Street, which is 1207 Taylor Street Northwest. And so you can go into those facilities and drop your completed recertification off. And then even here with our office, the Healthcare Ombudsman, we are here available to assist those who may have difficulty getting to the service center. They can bring their recertification completed here, or if one comes here, and let's say, for example, someone's illiterate, they may not know how to read. And so, or fill out the forms. We have staff available on our team, and we will assist you in office in completing those forms. Once completed, we'll then send them up to the Economic Security Administration on your behalf. And so, like you said, it can be very daunting, but we have a team set up here in the Ombudsman's office, working in collaboration with those at the Economic Security Administration to ensure that there's no lapse in coverage during this time.
How about if English is your second language? Are there options for those who do not, English isn't their first language?
Yes. So when one completes their initial application, they have the option to select which language they prefer their correspondence to be sent in. And so depending on what you select, that determines how you receive your recertification. So if you select Spanish, then your recertification is sent to you, and it's all in Spanish, and you fill it out and you send it in. Even on District Direct, you can see the language that you ascribe to, and so that's the good thing. And if someone comes into the Ombudsman's office and let's say you speak Spanish, we'll call up a Spanish interpreter using the language line, and we can go through that application to ensure that it gets completed and submitted. So regardless of the language, don't let that be a hindrance. We will work with you to ensure we get those forms completed, and we'll have someone through the language line on the phone with us going through the application.
And Daisha, first of all, am I pronouncing your first name correctly?
Daisha.
Daisha, thank you. I'm
Yes.
adding syllables. I thought I was butchering that. Daisha, is there a best way to complete the form? I hear David saying you can walk in, you can do it online. Is that word operable? Is there a best way to process your application?
I wouldn't say that there's a best way, because all of the ways to submit the application are, accessible to those who need to submit it in whatever form is best for them. Like I said, online is the fastest way. Of course, if you send something in the mail, we have to wait a couple of days to receive it and things like that. But I wouldn't say that there's a best way, but if possible, for those who have access to computers, to the internet, to the library, and they can actually go online to submit their application again to districtdirect.dc.gov. It's the fastest way for us to receive the application to be redetermined for eligibility. But all the other options are still available to those who need those options.
When is the deadline for folks who are listening? They're like, when do I have to have this information in?
So everyone's recertification or redetermination period, it's different. It's based on the original receipt of your application when you applied. However, once that recertification date comes up, they will receive a renewal packet in the mail within 90 days of their recert period. So just to give an example, if a person has to recertify in April, they will receive that in the mail between January and February, which gives them enough time to go over their application, report any changes that has been made, and submit that so that their information can be updated in the system. So it's individually based. Everyone doesn't have the same renewal date. We're just reiterating that effective April of 2023, we just went back to its original way of having to recertify every year instead of it being auto extended as it was during the pandemic.
David, as I'm sure you know, all of us, whatever it is, whether it's admissions, whether it's getting our driver's license renewed, I mean, there's always deadlines, and we know the deadline, and paperwork somehow gets shuffled around on the counter with our mail, and we miss deadlines. Right. What are the repercussions for missing your deadline, whatever that deadline might be? What happens if you miss it?
So in the event that, for example, that my coworker gave, if I'm supposed to complete my Medicaid recertification by the end of April, but I failed to do so, come May 1st, I would not have health insurance through DC. And so this is very, you said it earlier, you used the word daunting. This is scary. This is, it can really lead to some unfortunate things. And here in our office, in the ombudsman's office, we see this every day because we get the calls from those who are at the pharmacy to get their medication. And they didn't know, like Daisha said, they didn't know that they needed to recertify because maybe they weren't listening to your show. They weren't paying attention to all the bus ads. We've put a lot of, we've tried to inundate the market in this area with just information telling people they have to, but people are showing up to the pharmacy not knowing that their Medicaid is ended. And that's when they have to contact our office because at this point, it could potentially become an emergency. And so one thing we tell people to do, if you don't know when you may need to recertify, you can call the ombudsman's office today or tomorrow morning at 202-724-7491. We can pull up your Medicaid information in our system and we can tell you, you know, you're good until June 30th, or you're good until July 30th, or you were supposed to recertify a month ago. You still have time to complete your recertification because there is a grace period. Now, this grace period doesn't prevent your coverage from terminating. It just means you can complete the recertification within, I believe, 60 days of the termination date, and they will backdate your coverage, right? So there is a grace period, but if you want to get ahead and stay ahead, I would suggest call the ombudsman's office at 202-724-7491 so we can at least look in the system and tell you when you should anticipate your recertification paperwork showing up in the mail. But it can really be daunting if you don't complete that, and it can lead to unfortunate repercussions of essentially not having health insurance in the event where you may need to go to the doctor. People are being turned away at doctors for not having health insurance. And so we want to avoid that by at least knowing when you should anticipate those forms to arrive in the mail by contacting our office.
Daisha, how many folks are we talking about in the district that need to be recertified or that are covered through Medicaid? Is there a number you can share with us, or a roundabout general number?
There are thousands. I mean, DC has a large population and it's growing every single day. So there are a lot of individuals and families that benefit from the DC Medicaid program. Like I said, there are thousands of, families who utilize these services. So we're trying to enforce, looking out for the mail. The renewal packet will have a green line. Like we try to initiate, green means go. So if you see a renewal packet with a green line under it, that means go. Renew your benefits as soon as possible to prevent that termination that David was talking about.
And in terms of, if you're new, you're not recertifying, can you apply now? And it's still, is it different if you're just becoming eligible for Medicaid? Is that different than being recertified during these timelines and deadlines?
It's a little different. However, if you're applying for Medicaid, you can apply at any time. It's not like your private insurance. We have open enrollment times and things like that. If I am a DC resident and I am uninsured, I can apply for Medicaid effective today. They do have the Department of Human Services has up to 45 days to approve or deny an application based on what's in that application, but you can apply at any given time if you are in need of insurance.
David, we're going to take a break in a few moments, but I want to be sure before we go to the other side on the Sirius XM channel side that folks listening, they are hearing websites, where to go, and we want to be sure that they clearly understand the websites, and we'll have it on our website. But can you share, David, again, where they can go online to do what they need to do to make sure they continue to have coverage?
Absolutely. To complete your recertification online, you will go to districtdirect.dc.gov, and that's the online portal. You create an account online, and there you would see, once you put your information in, you'll see something telling you it's time to complete your recertification. And if you have questions about when it's time to complete a recertification or when you're up for recertification, you can contact the Healthcare Ombudsman's office at 202-724-7491.
And can you give that number one more time, David?
Absolutely. It's 202-724-7491.
All right, folks. So you've got a little of the information. We're going to continue this conversation. But again, if you are currently receiving Medicaid and you want to be sure that you continue to receive it, follow the information. Go to the information on WHUR.com where you can sign up and complete your forms. And our guests are giving you that information. We're going to continue our conversation, but we're going to take a quick break. But don't forget, you can hear every edition of the Daily Drum Insight segment via podcast on WHUR.com, or you can download the 96.3 HD2 app on your smartphone and hear the program live in its entirety. Again, this conversation will continue online and on SiriusXM channel 141, 96.3 HD2, and 98.3 FM. The original Quiet Storm with John Mons is next on 96.3 WHUR. Welcome back to the Daily Drum on SiriusXM channel 141, 96.3 HD2, and 98.3 FM. I'm Bramante Bryant in for Harold Fisher. Tonight, we're talking about Medicaid and making sure that you are recertified if you have Medicaid coverage. That is all important. We all know how important having medical insurance is. And if your medical insurance is through Medicaid, with the pandemic over and with you automatically being recertified, that no longer is the case. Now you have to manually go in and make sure you are registered once again. So it's an important conversation tonight. Healthcare is right at the top of all of our list. Our guest tonight is Daisha R. Watson. She's a management analyst with the DC Department of Healthcare Finance, and David Kennedy, Associate Healthcare Ombudsman with the Office of the Healthcare Ombudsman and Bill of Rights. I'm going to go back to you, Daisha, and talk a little bit about, you mentioned that if you miss the deadline, right, and you fall off the rolls, there is a kind of some wiggle room to get you back on there, if I understood you correctly. Is that correct?
That is correct. So all of DC Medicaid benefits will end on the last day of the month, depending on when your recertification date is. So if you do not submit your recertification, for an example, by the end of April, which would be April 30th, you do have a grace period to submit your renewal to be redetermined for Medicaid benefits, and those benefits will continue. So if the benefits end and it's May 4th, and you say, oh, it's too late. No, it's not too late. You can still submit that renewal. You can still recertify to be redetermined for your Medicaid eligibility. And they have up to 90 days to submit that renewal.
So say I have Medicaid, right? And now I'm waiting through the renewal process, or say I kind of lose it, but now I'm putting in my application, but I have to go to the doctor. And then there's a bill. Will Medicaid retroactively cover that bill while I'm waiting to be recertified?
Great question. So once your benefits are updated in the system and it now reflects active, Medicaid will cover that bill. As long as you have active benefits during the date of service, Medicaid will then process that claim and pay that bill. So if you're waiting and you were renewed, say May 15th, Medicaid will go back to bring you active as effective May 1st. So if you have any bills that were collected during that time, those bills will still be eligible for payment under the Medicaid program.
David, in terms of the process of filling out the paperwork, is there a sense of how long it takes? Because I can hear people thinking, oh my gosh, this is going to take me 2 days, 3 days. Can I do it in an hour? Can I get somebody to help me? Can my son help me? How would you describe how long the process works, sort of the nitty gritty part of that.
Okay, so I want to explain when that packet comes in the mail. The recertification packet uh, is built for a family of at least 5. So that means there's going to be a lot of pages in that packet that if it's a family of 1 or 2, they won't even pertain to you. So when you originally get that form in the mail, it's going to look overwhelming. And we have people bring them into our office all the time. And the first thing they say when they see this is, I don't know how to do this, because it is very overwhelming. Sometimes it can be anywhere from 50 to 68 pages, that type of overwhelming. But understand that it's built for a family of 5. So, yeah, it can be overwhelming. But as you start going through and filling it out, you'll see it starts with asking your name, your date of birth, your phone number, information that we all have readily available to us, or we should have readily available to us. If you need assistance from a family member, by all means, if you trust that family member, then have that family member assist you. And if you don't feel comfortable working with anyone else, and you just want to speak with someone who can help you, you can always come into our office as well. The ombudsman's office. You're welcome to come into the ombudsman's office, and we will gladly assist you. We don't want to put anyone on the spot. So if you come in the office with your forms and you're unable to do it, we will assist you in completing those forms to where by the time we're done, all you'll have to do is sign it. Or you can go into one of the Economic Security Administration offices, and I gave those addresses earlier. But 645 8th Street Northeast is the main one. Our office here is located at 441 4th Street, Suite 250, and we're on the north side of the building, but that's in Northwest DC, the Ombudsman's office, and we'll gladly assist you with that application or recertification.
David, if you live in Maryland or Virginia, can I come into DC for help?
Unfortunately not. We will assist you and we'll give you the contact information for your local office where you can go. But our reach only extends so far with regard to DC Medicaid.
Deja, why not do the automatic renewal? I know it was automatic during the pandemic, and you can talk a little bit about the reasons for those. We can make assumptions of why that was, but it's kind of good to hear why that would be. And I would want to know, was that pretty smooth? And if so, why not continue automatic renewals? What's the downside to doing that?
Ultimately, DC Medicaid is an income-based program. So we do the annual renewals because things are constantly changing. A person may apply for Medicaid because they did not have a job and find employment, so their income changes, which then may not make them eligible for the Medicaid program anymore. So those are factors, that goes into your eligibility for DC Medicaid. During the pandemic, as we all know, it was such a traumatic time for everyone. And one of the most important things that we wanted to ensure was that everyone can get their medications, can still see a doctor if they're sick. We're having COVID tests done and, those things. And it was very important to ensure that no one went without coverage. So if the DC residents already had active Medicaid coverage when the pandemic hit, those members were already extended. Once it was deemed a public health emergency, everyone that was on Medicaid, their benefits were extended. It would be nice to continue to do that. But like I said, as far as the changes that come about, we're going back to Medicaid's original way of doing things. And Medicaid is based on, specifically DC, is based on DC residency, your income, and family size. If a person is not eligible for DC Medicaid, which is funded by the state, they are able to apply for private insurance through DC Health Link, and they can select a plan that's suitable for them and receive tax credit for that coverage. So I would love for it to be extended and we just continue to extend those benefits. But like I said, with the changes that are taking place, we're going back to its original way of doing things. So we have to renew every year just to ensure that persons are still eligible to receive that benefit.
I know a lot of folks are probably listening and they may have Medicaid and some may not. And they're hearing about the deadlines and the new recertification process, but they're also probably listening thinking, I've always wondered about Medicaid. I've wondered whether or not I'm eligible for it. I wonder, if I could apply for it. So if we could just back up just a little bit, Deja, about just how you know whether or not you're eligible for it. I know you're talking, it's about income, but if you could talk a little bit, and David, I'll have you too, about, what are the parameters? Does it depend on the household? Does it depend on dependents? Depends on the total money that's coming in the house for those who are adults. Can you talk a little bit about that, of just how it works for those who are wondering, hey, am I even eligible for Medicaid? I hear them talking about the subject, and I've always wondered, what is it, and how can I find out if I'm eligible for it?
Absolutely. I always encourage people to apply. That's the easiest thing that you can do, right? But each household has different situations. Okay. So while Medicaid is income based, there are also other factors like medical necessities that may also deem you eligible for Medicaid. So I always say each household is different. And while the basis is DC residency, income, and family size, there are different criteria that may deem a person eligible who typically wouldn't be eligible in some cases. But it does income as far as everyone in the household who is applying, that income is considered. For example, husband and wife applying for Medicaid, both incomes will be considered for eligibility. In some situations, depending on the need, there are different programs under the Medicaid branch, like our long-term care uh, and the EPD waiver, which is elderly persons with disabilities waiver. Their income criteria are a little different. So that's why I said it really depends on each individual family and their situation. And if a person just wants to know if they are eligible, just apply. Just apply. And a determination will be made to determine that eligibility for that family or for that individual.
David, does DC have any, for lack of a better word, right, challenges, scenarios, something different that the district uh, has to handle with Medicaid, say that other jurisdictions around the country don't, or is that process pretty much consistent from state to state and to the district? Is DC any different from any other areas?
No, DC is not any different from any other areas. I will say this though, DC does one of the best jobs, in my opinion, in the country of ensuring that its residents have access to health insurance, not just through Medicaid, but then there's a program we call DC Alliance for undocumented persons, where you may not be a U.S. citizen, you may be undocumented, but if you reside here and if you can prove that you live in DC, you can apply for DC Alliance. And you're still held to the same income requirements. However, not all states and not all jurisdictions provide that type of benefit, which makes DC very unique in the sense that we recognize that all people deserve health insurance. And so that's something very unique to living here in DC. And a lot of people do take advantage of that, to where even undocumented persons are able to receive health insurance, go to the doctor, get their medications. And so that's something I would say is unique to DC.
David, are there any consistent that you've seen, and Deja, you can also speak to this, missteps that folks make in this process? Is there something where you see this often, whether it's the pandemic or whether we move into the normal process of recertification?
Yes. we as people like to procrastinate a lot of times. And in this instance, when you procrastinate, it can have some unfortunate circumstances, right? And repercussions. And so, like Daisha said, as soon as you receive that letter in the mail saying it's time to complete your recertification, don't put it off. I helped a really sweet lady today who came in our office. She doesn't need to have her recertification completed until May 31st. But here we are, and it's April 29th, and she's submitting her paperwork because it still takes at least 45 days to process this form, right? And so every day, hundreds and maybe thousands of forms are being submitted. So if you receive your documentation, I would suggest complete it and send it in as soon as possible to ensure that your eligibility doesn't terminate. Again, if you don't know whether or not we have the right address information on file, you can always call our office at 202-724-7491, and one of our team members will be able to let you know when you should anticipate your recertification and make sure we have the correct address information on file. So those are some of the biggest missteps, people procrastinating until the last minute.
Would you agree, Daisha, or have you seen anything different than that you can expound on?
I would agree. Most people think they have time. I think that's one of the things that we go, oh, I have time. And sometimes time leads into forgetfulness. So I will say, if the sooner, the better. And along with submitting those recertifications, like I said, there are proof of income, submitting the required documents necessary with the application to determine eligibility. Most times a person, I did my renewal, but they didn't submit their proof of residency, which again, only helps us to ensure that we have all of your accurate information. You could have moved between last year and this year. So proof of residency helps to process that to ensure that you're getting your proper documents. Proof of income, which would be your most recent pay stubs, to ensure that you are still financially eligible for the Medicaid program. If those documents are not received with the renewal, it prolongs it a little bit because that's needed to process to determine your eligibility for Medicaid. But I would say that those are the most two common things is, the waiting game and then not submitting everything with the application or renewal for it to be processed.
And I think you may have mentioned this a little bit earlier, but Medicaid for those who have children, is that process a little bit more laborious, or is there anything different about that for those who are reapplying?
I will say, as I said before, each case is different. We do take our children into a high consideration. Kids need to get to the doctor to go to schools and things like that. So we do try to ensure that families are getting these things in quickly so that they can be processed expeditiously, which will then prevent the terminations and things like that. We try to be, of course, as fair across the board when processing these applications. But I will say that sometimes, depending on a person's situation, may require a little more urgency in processing than someone else. But as far as children and being renewed, it is up to the parents to ensure that these recertifications and redeterminations are being submitted timely so that their kids and themselves don't lose coverage as a result of that.
David, you had mentioned earlier about how, some of us and some of those in the community really who aren't that sort of dexterous with computers and going online. And obviously there's an issue of our older folks, in the community, even those who are caregivers with senior citizens. What's your advice for them if they're new to the process, caregivers and those who are senior citizens?
So the interesting thing is every year someone is becoming a senior citizen. Every year somebody is becoming eligible for benefits that they may not have been eligible before. And I'm glad you brought that up because a lot of people are eligible for a program called QMB, Qualified Medicare Benefit. and they are on QMB, but they don't always equate that to Medicaid. QMB is a qualified Medicare beneficiary program, but it is funded and paid through DC Medicaid. And that program pays for the monthly Medicare premiums on the behalf of those who receive Medicare. They have to also complete a recertification. So you brought that up about seniors. Many seniors, as long in I want to say this, in DC has one of the highest thresholds of income allowances for people to qualify for QMB. The income limit to qualify for QMB or the Qualified Medicare Benefit Program in Washington, D.C. is $3,785. I'll repeat that. If your monthly income is under $3,785 for a single person or a couple, that limit is $5,130. You qualify for DC Medicaid to pay your monthly Medicare premiums. The monthly Medicare premiums right now are $174.70 per month. So if your income falls underneath those thresholds, you qualify for the QMB program. Now, to answer your question, many people on the QMB program, because they don't associate QMB and Medicaid together, unfortunately, they're not completing their recertifications because they didn't realize QMB is being paid by DC Medicaid. And so when you receive those letters, as my colleague said, you can bring that documentation into our office and we can assist you in completing that QMB recertification or the DC Medicaid recertification.
So, David, it sounds to me, and I'm hearing this, and I think I can kind of decipher information fairly well, but I'm hearing acronyms, QMB, and all the stuff coming in, and I'm looking at it, and when I hear what I could be eligible for, but I'm going, yeah. What it sounds to me like, and maybe this is just the kind of person I am, I like to be in front of Deja or David and go, tell me about this document. Does this now mean I'm eligible for this as well? Because going online, I don't know then if I'm going to know that. So it almost sounds to me that it's more advantageous for me to pick up that paperwork and come in to see these two experts that I'm talking to help walk me through this. I know that's more work for you all and more people standing in line. I know the whole online thing is a lot easier, but you know what I'm saying? It just seems like that would be the way to go to make sure you're maximizing benefits that you may be eligible for that you have no idea. Am I off on that?
That is absolutely correct. Because DC has such a gracious threshold where you can make under $3,785. And the interesting thing about QMB, there is no asset test. So they're not checking to see how much you have in your bank account or how much you may have in a retirement account. It's basically solely, now this is QMB compared to DC Medicaid. QMB stands for Qualified Medicare Benefit. It pays your monthly Medicare premiums, and it also pays the 20% that Medicare does not pay, as long as you go to a provider that accepts DC Medicaid. So if you are receiving Medicare and you live in Washington, D.C., you can potentially be eligible for the Qualified Medicare Benefit through DC Medicaid if your income is under $3,785. And you can call our office. We can assist you with completing that application at 202-724-7491. You can go into the service center, 645 8th Street Northeast. You can receive assistance there, or you can go on District Direct and complete the application online. There are other ways as well, but these are the main ways that you can apply.
Daisha, I'm assuming it's safe to assume not every provider accepts Medicaid. And so how do you go about finding out what provider would accept Medicaid if you have that kind of coverage?
That's absolutely correct. Not all providers do accept Medicaid. They have that choice of whether they want to be enrolled as a DC Medicaid provider. But the easiest way, as we always say, is the online access, which would be medicaid.dc.gov. You can go online and search.
Repeat that again, Deja.
I'm sorry.
Repeat that website again.
It's dc-medicaid.com.
Okay.
And they can go online to search for providers. And then, like David said, they have resources in the ombudsman's office to assist members with finding, medical providers, dental providers, and things like that in order to ensure they are going to a DC Medicaid provider so they don't have issues later on when it comes to billing and things like that.
And if you have Medicaid, and again, I believe it's such a great conversation because, many folks may not really even know what Medicaid covers. Does it cover mental health professionals, dermatologists, others? David or Daisha, either one of you all can take that.
Yes, absolutely. DC Medicaid for the basics, they cover your dental visits, your primary care physician visits, and depending on the managed care plan that you're enrolled in, because Medicaid has three, depending on the plan that you're enrolled in, will then determine the necessary steps you would need to take to see the specialists. And those specialists are the dermatologists and things like that. But Medicaid does cover mental health services as well. Depending on the need of the individual will determine which route that they would need to take in order to see these individual providers.
Let's talk a little bit in our last few minutes about outreach. I think both of you all kind of mentioned that there's stuff on buses and things of that nature.
Yeah.
And of course, for folks to really know what they need to know, you all, I'm sure part of your job is getting the word out as you're doing tonight about, hey, listen, this is what's going on. This is what you need to do. Here's the process. Beyond being on the Daily Drum in the Insight segment, which we love, what other things that are you all doing to get information out there to folks to know about what's happening?
I would say we're doing everything under the sun. As David said, we have advertisements on the radio, advertisements on the buses. We are actually going out into the communities in all of the wards, having different segments about how you can renew your Medicaid. We also have a bi-weekly meeting that takes place online where we're reaching out to the community, showing them how to create a district direct account, how to renew their benefits, what to expect. And like I said, that happens bi-weekly. And they can email us at medicaid.renewal@dc.gov to be added to the email list to receive that link if they would like to, have a more virtual and able to see how to do these things online. But like I said, we're going out in the communities. We're finding we have flyers that goes out. So all of our outreach events, we take flyers and information to pass out to people to let them know, hey, we're here for you. Hey, here's the information to renew your benefits. So we're doing everything we could possibly do and telling people word of mouth. Everyone knows someone in the district. Hey, are you on Medicaid? Make sure you renew your benefits. So we're trying to put out there in every way possible the importance of renewing your Medicaid. And if you have any questions, along with the Ombudsman's office, we have our eligibility hotline as well, which you can call to inquire about your Medicaid benefits if they're active, they're due to expire. And that number is 202-727-5355. And that's our eligibility hotline.
All right, I'm going to give you each 30 seconds each because I think our listeners is important to know because what you all are doing is, yes, you've got a paid position, but you're also serving the community in what you do. So in 30 seconds each, what inspired you to even get into this kind of industry to serve as you're doing? David, I'll go with you first.
I would say for me, my first job out of college was working for the Social Security Administration. And so just that experience of helping people with their retirement, disability, and Medicare really kind of gave me some inspiration. And when I found this great opportunity here in DC, I felt like it was, the best fit for me. And so every day I have an opportunity to make a difference in someone's life, knowing that they can leave a conversation with me understanding that they have access now to go to a provider, go get medication, and be able to live their best life. So that's my inspiration, right? Just being able to help people. And I love what I do every day.
And how about you, Deja?
Well, for myself, as a native Washingtonian, I was born and raised in DC, and I had the privilege of helping my uncle who was disabled and an elderly grandmother go through this same process. I had no idea I would end up here, but I love helping people so much. Once the opportunity presents itself, I actually worked alongside of David, very closely with David. I was in the ombudsman's office for 12 years before my current position. So it's the compassion that I have for the people. And at one point in my life, I too was a Medicaid recipient. So I understand the process. I understand the benefit. I understand how now I have a greater understanding of how it works and why it's so important to our communities and our families, who are in need of these services. So it's just the love that I have for my people. And I'm going to continue to show up for them and help them as much as I possibly can.
She is Deja R. Watson, Management Analyst of DC's Department of Healthcare Finance, and David Kennedy, Associate Healthcare Ombudsman with the Office of the Healthcare Ombudsman and Bill of Rights. Thank you both so much. Important conversation, and for all of your information that you shared tonight.
Thank you.
All right, that's the Daily Drum for this Monday, April 29th. I'm Bramante Bryant in for Harold Fisher, the original Quiet Storm. Not the original Quiet Storm. You're already listening to the Quiet Storm, but that will do it for us tonight. Have a great night, and we will see you tomorrow.